bathroom breaks when you work in surgery. What's a bathroom break? Am I right? As a tech and a first assist, you're scrubbed in with your surgeon, doing surgery and operating on that patient, and suddenly you need to use the restroom. It's not quite that easy, unfortunately. So what do? What do? We just pee ourselves. Just kidding, no we don't, please. But I can tell you what, I know how to hold it. Yeah, I do. I've learned over the years. You're scrubbed in and you really need to pee. As a tech and first assist, you kind of just learn how to hold it and how to go between cases. But there are those circumstances where you just can't hold it. And when that happens, we look over at our nurse in the room and ask them to kindly call the charge nurse so that they can get someone who can scrub in to relieve you for a few minutes. So it ends up being a bigger process because you have to wait. Someone has to come in, open their gown and gloves, and then scrub in for you before you can break scrub and leave the room to go to the restroom. Not quite that simple, unfortunately. There have been circumstances that have happened where there's nobody available. Let's say it's the middle of the night, you get called in and you really gotta use the restroom. What are you gonna do? Is it better to pee on yourself or is it better to break scrub and go use the restroom? Ding, ding, ding. We have a winner. You're right, probably better to break scrub. That doesn't happen quite as often. Usually there's someone who's gonna be around during the day who can maybe come and break you out for a good 10 minutes. But if that happens, I've asked my surgeon, hey, I really gotta use the restroom. Do you mind if I just leave for a minute? I have everything you need up here on the Mayo stand. I'll be gone for just a minute, but I really gotta go. Especially when I was pregnant. Yeah, that was hard. And usually you can find a good point where you can run real quick and come right back. Yes. It's not quite as easy as using the restroom when you work at an